Hi students, this is your second video for MSDRG's case mix. So we're going to start off here with DRG optimization. Optimization is the term to use to describe the process by healthcare professionals to achieve the most accurate DRG assignment. Since many facilities are dependent on your prospective payment system, the use of DRG's data must be accurate, reflective of the course of treatment the patient received. So when reviewing the record, there's four areas that a coder may review for the optimization process. So we're looking at the correct designation of the principal diagnosis. We want to report all additional significant secondary conditions. Principal procedure needs to be accurate, secondary procedure, and then other things is age, sex, where did they go? So let's get into the selection of principal diagnosis. One thing I want you to remember when I'm doing this video, some of this material I'm skipping over, so disregard it. Just go by what I'm telling you in this video. So the definition of the principal diagnosis is the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. So we don't assume that the diagnosis listed by the physician or sequence is principal. Okay, so let's go by example one. Patient is admitted for care with the admitting diagnosis of CHF. After admission, was found out the patient had a subendocardial infarction. So, but let's look. The physician listed all these diagnoses: CHF, obesity, diabetes, cardiomegaly, hypercholesterolemia, and then we have our sudden cardio infarction. So, but after study, the infarction precipitated the CHF and was a cause of the admission. If the coder would select CHF as principal diagnosis, the facility would lose several $1,000s in reimbursement. Okay, now we're looking at DRG optimization. Remember, DRG optimization, principal diagnosis. Talk about that. If you have two diagnoses that both meet the criteria to be principal diagnosis, you can select whichever one that is going to optimize or bring more money into the facility. That is not fraudulent if they both meet that definition of principal diagnosis. So here we have a 68-year-old admitted through the ER, chest pain, shortness of breath. The impression included COPD with acute bronchitis. The patient is known to have diabetes, COPD, acute bronchitis. So final diagnosis included your diabetes, CHF, and bronchitis. The patient's condition of COPD should have been included in the final diagnosis, and given the circumstance of admission, should be considered along with the CHF for designation as the principal diagnosis. Remember, uncomplicated diabetes would not be a cause for admission. So at this point, you're going to compare the two weights for CHF and COPD to see which would bring greater optimization. Again, it's fine as long as both of them meet that definition. It's not fraudulent. Then you want to report all significant secondary diagnosis. These are conditions that coexist at the time of admission. They develop subsequently or they affect the treatment received or length of stay. So anything that is related to an earlier episode, they have no bearing on this hospital stay, are to be excluded. Okay, so what I'm going to do here, you can read through, these other definitions for diagnoses. Complications and comorbidities, we talked about those already. I'm not going to read through the definition. Talked about them in my first video. Okay, then we have the peer review organization, DRGs. I went through that. Here's just a little extra information. Payment error prevention program. Okay, so here we go with our relative weights and DRGs. Once again, each DRG is assigned a relative weight by the CMS. This weight is intended to reflect relative resource consumption associated with DRG. The higher the relative weight, the greater payment to the hospital. In addition, each hospital has a customized base rate to adjust payment. So let's talk about this. Let's go to what your assignment's going to be. Here's our formula. Okay, so we are figuring out relative weights. So hospital base rate times the DRG relative weight. So we have DRG 89. That relative weight is 1.1156. Again, these are changing with 2021, these weights have changed. So, but we're going to say that NICC's hospital base rate is $6,492. So what you do, you take the relative weight times the base rate. It's going to be $7,242.48. And that is going to be the cost for anybody admitted for simple pneumonia, which is going to put you in the DRG category of 89. That's what their hospital stay is going to cost. Same thing with 90, DRG 90. Relative weight times the hospital base rate. So $4,530 is going to be the base for, or the cost for that hospital stay if you get put into the DRG 90. Okay, so let's go ahead and you can follow along, pause. Let's just do a few of these. So once again, we're going to take 6,492 and we're going to times it by this first one. The relative weight is 2.6894. So this first one here is a cholecystectomy. Keep in mind, this is going to be, it's going to be higher because it's a surgery. $17,459.58. So the next one. This one was with CCs. This one's without CCs. So the relative weight is 1.617. You times it by the NICC hospital base rate, and that's going to be 10,497.56. Okay, so you can see the difference. Of course, with the complication, it's higher than the second one. Okay, so what we're going to do here, these are just some examples. I want to get into the case mix. We're going to do some of these problems here. So case mix is a sum of all the DRG relative weights divided by the total number of Medicare discharges. And we talked about this in the previous PowerPoint. So your case mix index reflects the relationship of the hospital's Medicare cost to that of all Medicare patients. The higher the case mix, the higher the reimbursement rate for Medicare discharges. This again is why it's very important for accurate coding to determine the hospital's case mix. So a couple of different things here. Remember, we want to take the total weight, relative weight, which is our total weight, sum of all DRG relative weights. Okay, so you're going to take that and you're going to divide it by the discharges. So at that point, it's going to be 0.818 for October. All right. There is another worksheet that I'm going to go through, but here is just going ahead and putting in your DRGs. This is not due. This page is not due. Okay. This page here, I'm going to run through, and this is going to help you do this very last page, which this very last page is what you are going to have to hand in to get graded. Okay. But this page here is pretty much the same thing, just different numbers. Okay, So with that, so if you want to do the first few here and then come back, compare your answers, or listen to me on the first couple, come back, compare your answers, that works too. Okay, so our facility, we have DRGs for respiratory infections and inflammations and pneumonia. Your facility has a base rate of 3,500. Given the relative weight of each DRG, determine your estimated payment. Okay, so we have the relative weight of DRG 79, 1.6300. We times that by the hospital base rate. See how I have it written here in the corner, which is $5,705. And same thing, times 35, there's my answer, times 3,500, there's my answer. Okay, a couple of different things that I do want to talk about. Let's state that Medicare for this DRG 79, they pay $5,900. Okay, this, keep in mind, Medicare pays you $5,900 and your hospital's only charging $5,705. It's a profit because you get to keep that money. You don't have to return that at the end of the year. Okay, but let's say DRG 80, your cost for that DRG at your hospital is $3,302.60 and Medicare only pays $3,000. That means you're taking a loss. Okay, so a lot of times it evens out. This one here, we're going to say Medicare pays $7,000 for DRG 81. So once again, you make a profit. You do not have to pay that money back. Okay, so you can go through here, same thing, times 3,500 to come up with your estimated payment. Keep in mind, these here, DRGs for respiratory infection, we are finding out our payment for the DRG. Now we are going to do case mix. Okay, we talked about case mix. So DRG 79, we know that it's 10 discharges. I need to go up to 79. Let's get the relative weight. Put it in here. So 10 times 1.630 equals 16.3. DRG 80, I have 5 discharges times relative weight for 80 is 0.9436 equals 4.718. DRG 81, 6 discharges. Again, I need to go up to 81, get the relative weight. Okay, so once I come up with all of them, remember it is the total. You total all the relative weights, which is 80.647. And now I add up all the discharges, which is 79. So I take, find out my case mix, it's total relative weight divided by discharges. My answer is 1.012. So this here, you can just look at that. But this is how, go back here. So we just did this worksheet here. I went through all the answers for you. Now you're going to have to do this one here. Remember, this is basically going to be times 4,000. Remember, when you go down to the case mix, I look at 195 and my relative weight is 0.7316 times that. Once I get all my relative weights here, I add them up. I add up all my discharges and we go back to total relative weights divided by discharges. So all that you have due for this assignment to add here is this last sheet. Keep in mind all of this is in shared files. This worksheet is pretty much what you're going to see on your exam. Once you are done, the answers will pop up, I think, the day after this is due next week. So it's easy. Just take it step by step, listen to this video again, compare your answers after the answers pop up. Everybody have a good day.